what's the problem? Do we feel the need to build a better mousetrap? It's because we can't entirely explain some of the things about Cushing's. That means our understanding of it is wrong. And if our understanding of it is wrong, then our treatment of it is wrong. Who is Cushing, by the way? Cushing was a neurosurgeon and a pathologist who lived during basically the transition of the last century, 1869 to 1939. He had a big thing for brain tumors, and so that interest of his became the focus, or the way that conventional practitioners pretty much unilaterally think about Cushing's today. So pituitary-dependent hyperadrenocorticism is or PDH is the acronym that probably appears in your dog's file in your veterinary clinic, and it's the diagnosis that everyone is sort of trying to make when they test your dog. He identified those pituitary tumors, which are rare, and their symptoms. The pituitary tumor, of course, as we'll talk about in the next slide, secretes a bunch of hormones, and those hormones go to the adrenal glands and cause them to secrete too much cortisol, and then you get the classic signs of Cushing. So very hungry, very thirsty, hot, restless, gaining weight in the form of fat, but meanwhile your muscles are wasted, and so dogs can get that thin-walled abdomen that, together with all that abdominal fat, gives them that classic pot-bellied look. And this became, like I said, the dominant thinking in veterinary medicine, that if you have those symptoms and you have too much cortisol, it must be a pituitary tumor, because the first guy to identify this syndrome said it was so. And I'm here to tell you that it's not always the case. Here's that different graphic just showing that link between the pituitary gland and the adrenal glands, which are located right by your kidneys. So again, we have this hormone called ACTH, adrenocorticotropic hormone, going to the adrenal glands and causing them to secrete too much cortisol, believed to explain about 80 to 90% of Cushing's cases. The tumor in the brain is benign, so don't worry about it if your dog really has that. It's not like it's going to turn into brain cancer or anything. So it's not easy to treat that pituitary gland, nestled as it is deep inside your brain. And so all the drugs and conventional treatments, for the most part, they focus on the adrenal glands. There is one drug that tries to approach it from a brain perspective, as we'll see, but it doesn't really work that well. When you probably had your dog be tested several times, because, as I said, when a veterinarian sees that collection of symptoms, they think, oh, this must be a pituitary tumor. And so they do the ACTH stimulation test, usually on a repeated basis, looking for the telltale sign. And that telltale sign is that when they inject that hormone, eventually your dog releases, there's a spike in cortisol levels that is way above normal. And then they go, oh, look, the adrenal glands are hyperfunctioning, and so they must have the pituitary tumor, and let's go ahead and start treating. The frustrating thing is, for veterinarians and for the owners, is that sometimes dogs will get this test done repeatedly and not show that telltale ramping up of cortisol, even though they have the symptoms. And so this became known as atypical hyperadrenocorticism, or AHAC, where, by gosh, they got the symptoms, they must have it, and then they do the test and they can't prove it. There's another test that used to be considered more accurate, but now it's not the low-dose dexamethasone suppression test, which basically involves essentially giving your dog a little teeny tiny bit of cortisol. And of course, dexamethasone is quite a strong drug, and so the adrenal glands, if they're normal, should see that cortisol analog coming in and go, whoa, we got way too much cortisol floating around, and the adrenal gland activity should be suppressed. If it's not suppressed, then again, these adrenal glands are presumed to be hyperfunctioning, and therefore there's a presumption the dog has a pituitary tumor. All well and good, except that treating the pituitary oftentimes doesn't work. So the drug that's used to try to treat the pituitary directly is called anapril, which you might have heard of as a treatment for behavioral issues in dogs, canine cognitive dysfunction, so-called. It raises dopamine levels in the brain, always a good thing. And that increased dopamine level is also supposed to reduce the sensation of stress, reduce the stress response by kind of shutting down the pituitary stimulation of those adrenal glands. But it doesn't work that well, so it's seldom used. And the fact that it doesn't work that well it's just kind of skipped over by veterinarians. They don't change their view that this is a pituitary tumor problem. They just move on to other drugs. But it should kind of signal to us that maybe it's not a pituitary tumor problem. So what's the problem? Why do we feel the need to build a better mousetrap? It's because we can't entirely explain some of the thing about Cushing's. That means our understanding of it is wrong. And if our understanding of it is wrong, then our treatment of it is wrong. So what are we missing? Well, they've looked to see if these dogs really have pituitary tumors, and a lot of them don't. And the ones that do, if they try to treat them with radiation or the drug anapril, it doesn't work. You can get rid of the pituitary tumor, and yet the dog still has all its symptoms. So again, we have this built-in bias that it must be a pituitary tumor because the first guy that described it said that was the case. But it appears the pituitary is not involved in a lot of animals. So that means these adrenal glands are apparently hyperfunctioning on their own, which might suggest, oh my God, I've got adrenal gland cancer and I've got a functional tumor, and yet oftentimes that's not the case either. They're just benignly hyperfunctioning. So this kind of information is seldom thought about or discussed by veterinarians because it interferes with the neat and tidy picture that we have of the disease. But the neat and tidy picture is clearly there's something wrong with it. As I said, these atypical cases is the other problem, where they test and they test and they test to the point that one day when your dog finally does have an extreme level of cortisol, there's like a party. Yay! Now we can start treating. But what about all that other time that you were waiting for the positive test? You got this hungry, thirsty, restless, unhappy, overweight dog, and you can't start treating because the treatment is to essentially damage the adrenal glands. So those are so-called atypical cases, but I actually find that probably the majority of patients, atypical because they're not behaving the way we think they should, but not atypical in the fact that this is actually how a lot of Cushing's cases go. So there's a problem with our tidy little understanding of things, and we need to take a fresh look.